Virtual reality has been around forever. And the promise of virtual reality is that it was going to provide these exceptional graphics for us to better be able to visualize things. The trick with virtual reality is that it's completely immersive. So the person who's wearing a virtual reality headset can't have a meaningful interaction with their natural environment. So it was really important that the hardware progress beyond standard virtual reality into the augmented and mixed reality spaces for it to become something we could use in a procedure where we have to be present. We have to be able to see our patients, our anesthesiologists, our nurses, our coworkers, and interact with them in a meaningful way. SENTIAR currently receives the data from commercially available electroanatomic mapping systems and then takes that data and displays a real-time three-dimensional hologram of the patient's unique cardiac anatomy, as well as where the catheters are within that anatomy. The way we currently do these procedures, and the procedures that I'm specifically talking about right now are cardiac ablation procedures, is that we use other sources of visualization to help us navigate to points of interest and to identify the normal electrical system of the heart and the abnormal electrical system of the heart. But this really requires the physician to be able to have a really good mental model of what they're seeing on standard two-dimensional imaging. We know that not everybody's very good at that. And certainly these technologies are going to allow for people who may not have as good an understanding of those three-dimensional relationships. It is going to improve their level of understanding. However, the power in these tools, we believe, are in more than just that. It's going to be in the control and the connectivity and the computation that they can provide. When most people think about virtual reality and augmented and mixed reality, they think about holograms. And there is truth in that. There is a benefit in visualizing things the way they actually are, in true three dimensions. But there are other things that we're learning as well that are just as, if not more important than those holograms. Number one, the ability to control the data you're looking at. So to manipulate it and move it in a way that you can exquisitely and uniquely understand what you're seeing in that particular patient is going to be hugely important. We also think that there's going to be a lot of utility in the ability to connect various data streams together so that one person isn't trying to put together 5 different data streams in their head, but rather we do that work for them. It is computationally possible. We just haven't done it yet.